welcome. I'm Sharon Flanagan. I'm the managing partner of Sibley's San Francisco office. And on behalf of all of the Sibley partners here today, I want to thank you for coming. Really excited about this program today. So I think everybody's been hearing lately about this convergence between the life sciences industry and the traditional tech industry. And if you talk to senior executives at very significant pharmaceutical companies, they will tell you big data is what all the senior leadership is talking about. And then if you talk to technology companies, particularly very innovative ones, like the ones we have here in the Bay Area, they are really focused on the opportunity in healthcare. So it's an exciting time to see these two industries converging and the opportunities that will develop from that. So today's program is really going to shine a spotlight on all the opportunities, the blind spots, how do you monetize some of these exciting new opportunities, and then finally, how do you bridge the gap between innovators and regulators? That's always a perennial issue for those of us here in Northern California. We'll have 4 panels today with industry leaders and with Sibley lawyers as well. And then we'll have several networking breaks so you can talk to your colleagues and make new connections. And then we'll conclude today with our keynote speaker, Jaren Lanier. Jaren Lanier is known for having coined the phrase virtual reality, which my 11-year-old was really impressed by this morning when I told her that the guy who actually came up with the idea of virtual reality was talking to us today. He also has written books, Who Owns the Future? And You Are Not a Gadget. Although by the end of today you might think you will become a gadget, but right now you're not still. I also wanted to encourage you to download our Sibley Event App. I think you've got papers on your table that explain how to do that. You'll see bios of the speakers, you'll be able to see who's here today. You'll also be able to give us feedback, which we would greatly appreciate. And then for those lawyers in the room, if you're interested in getting CLE, you can do that at the registration desk, so be sure to get that paperwork filled out. So with that, let me introduce my colleague from our Washington office, Anna Spencer, and she's going to moderate our first panel on navigating the digital health opportunity. Thanks, Anna.
Thank you. Okay, can everyone hear me? Great. So I'm very happy to be here today. Before we dive into the meat of the program, I'm going to ask each of the panelists to introduce themselves, and then I'm going to give some opening remarks, and then we'll hear from each of our experts here. We're very lucky to have been able to assemble this talented group, and I'm very excited to hear what they have to say. So I've already been introduced. Michael?
Okay, I'm Mike Tabor. I'm a platform architect with Intel Corporation. I focus primarily on medical devices and medical device security.
Hi, I'm Josh Stein, CEO and co-founder of a company called AdhereTech. So we make patented smart pill bottles that track and improve medication adherence. Basically, these bottles send us streams of data telling us if patients have or have not taken their meds. If they have not, we send them real-time alerts, and we collect and analyze the data regardless.
I'm Reese Jones, and I'm one of the associate founders at Singularity University on the NASA campus down here, and that focuses on cross-training of people and technologies that are changing rapidly.
All right, great. So our panel is on digital health. I like to orient people and define terms before we start talking in depth about a topic. So what do we mean by digital health? We mean the revolution that we're starting to see in healthcare, where more and more healthcare is being delivered on and through internet platforms in ways that really engage patients and healthcare providers in new and exciting ways. By digital health, we mean everything from fitness trackers and wearables, mobile medical apps, internet inhalers and other internet-connected medical devices. We're seeing really amazing things like drugs being used with embedded sensors that emit data on when a patient is taking their medication, what the adherence is to that medication, and everything in between, really anything that touches the internet and the delivery of healthcare. Eric Toppel's book, The Creative Destruction of Medicine, I think puts it really well. He enumerates how these digital technologies, social networking, mobile connectivity, and bandwidth, increasing computer power and the data universe will converge with wireless sensors, genomics, imaging, and health information systems to essentially and creatively destroy medicine as we know it today. He refers to this as digital medicine, or the digitization of human beings, which takes it even further. Life science companies, fully appreciating the importance of the transformational changes that we're seeing, are wading into the waters of digital health in a big way. I worked with a company on the first digital medicine new drug application, and we're just seeing more and more of this. So I think we're going to be spending our time well today. Of course, digital health raises a wide range of privacy and data security concerns. In terms of privacy, there's the issue of applicability of the federal law known as HIPAA. When the first regs were developed under HIPAA, and I don't want to date myself, but I'm going to have to, in 1999, that's when I first started working on these rules. There was no iPhone, so when the regs were developed, it's no surprise that they really don't address digital health or the way medicine is being delivered today. So we're really seeing new technologies test the boundaries of the law here. And we're seeing a clash of cultures. So healthcare in the United States is one of the most heavily regulated industries in the US. And then on the other hand, we have tech companies in Silicon Valley, their businesses to innovate. They understand and appreciate that consumers don't want innovation at the speed of government, which is like the snail's pace at times. Beyond HIPAA, a fundamental principle in privacy law is that you give people notice regarding how their personal information is being collected and used. But that's challenging when you're talking about digital health and you have really small screens. How do you convey that potentially complex legal information in an easy to use and understandable way? And how do you get them to care? You know, this is an area that I'm very interested in. It's my work, my professional life, but I don't even read these policies. So how do you get people, how do you communicate that to people? But providing notice is mandated. It's mandated by the great state of California. It's mandated by the FTC, at least in this context. And we've seen that companies that fail to provide notice or provide notice and then fail to abide by their privacy notice, enforcement actions have been brought against those companies, and we'll continue to see that. And then finally, we'll talk about the state of privacy on the internet, and unfortunately there we'll see that it's not that great. So FTC in 2014 did a study on consumer-generated health information and found that of the 12 health or fitness apps that it studied, that those apps relayed information about the consumer to 76 companies, and that one app delivered health information to 18 different companies. And you're thinking, well, why in the world, who has my data? Why is it being sent out beyond what is necessary to provide me with the health information through the app that I need? The Financial Times and JAMA have also done studies that prove that there is widespread sharing with data brokers and internet advertisers. And the concern, of course, is that this information will be used to make adverse decisions about people, either by employers or insurers or financial companies that are making decisions about credit applications. Now, some people will say that if you get an app for free, you are the product. But the problem is that regulators, they don't buy that argument. They don't accept that. So our panelists, now turning to them, will cover the waterfront. And I don't want to leave you with doom and gloom, although part of my job is identifying risk. Our panelists will talk about the practical ways in which they tackle these problems and give you insights into how to do that. So turning it now to our panelists, I'll start with Josh. So Josh, as I mentioned, digital health is developing at such an accelerated rate that it's outpaced legal frameworks for protecting privacy. Can you briefly discuss your company's product again and discuss how an early stage company such as yours has tackled some of these data privacy and security concerns?
Yeah, absolutely. So first I'll elaborate on the product. Before I do that, I'd just like to give a description of who uses our product and how. So currently, AdhereTech Smart Pill Bottles are distributed by leading pharmacies, 2 top 10 mail order pharmacies in the US, a number of top hospital systems. We're working with pharma companies. So I just mentioned this to say that this is much more than a concept. This is a product that's out there for some of the most sensitive meds, cancer, HIV, Hep C, that exist. Now, because these are used by such large companies for such sensitive meds, regulatory compliance, data security are of the utmost importance to us. So we sort of approach this in 2 ways. First is, we had a real concerted effort to rely on experts in their various fields. Sometimes that's lawyers, sometimes that's consultants, to make sure we're all buttoned up in every single aspect. So that means, with the FDA, under HIPAA, this is a wireless product that has the same internal components as a cell phone, so we had to register with the FCC. There's a bunch of other types of testing that is a medication container you have to go through in order to make sure that this is safe to store meds. It's called USP testing, so we have to do all that. So we relied on a lot of lawyers and consultants. It wasn't cheap, but it's not only a really good investment for us because it means we're low risk and a lot less likely to hurt ourselves or anyone else, but the benefit is it really helps us on the sales front too. So when we speak to these big organizations and we show them that we've complied with all these different regulations and we have of course supporting documentation for all these, it really legitimizes us in their eyes. So on the one side, there's the regulatory aspects that we follow. On the other side, from a design aspect, we really decided to limit our risk when designing the product and the system behind it. And by that, I mean the data that we collect. We limited that on the patient identifying information front as much as possible. So a few ways in which we do that is the bottle itself doesn't, so the bottle just sends measurements. There's a number of different sensors in the bottle. It's not actually sending patient information through the airwaves. All patient information is stored on our servers, which are secure IBM soft layer servers, and of course there's all existing security protocols that need to be there. So I guess in summary, we approached it from the regulatory aspect and the design aspect, but both are very important and our customers care a lot on both fronts.
So securing patient consent is important, and it can be a big challenge. Can you speak a little bit about how, given that you don't necessarily have a direct interface with the consumer, especially where the bottle is provided, let's say, at a pharmacy, explain how the company has handled that issue.
Yeah, absolutely. So basically the way patients get our bottles is we form a partnership with the pharma company for a specialty medication that's typically high cost. The reason why it has to be high cost business-wise is because our business model is get this into patients' hands for free and then partner with the entity where the ROI is seen when medication adherence is improved. So we partner with the pharma company. However, these bottles are distributed from pharmacies, and then there are different allowances between the pharma company and the pharmacy as to who can see what. Basically, the pharma company can't really see patient data. So basically, when a patient fills that med for which we have a partnership, at the pharmacy, they're made aware of their eligibility for a free AdhereTech Smart Pill bottle, and then they opt in. The opt-ins do vary based on the drug, well, more so based on the pharmacy for which we partner, but patients have to be read and verbally consent, sometimes written consent, that they do want this bottle, and they have to sign off on the information of theirs that's being sent through the airwaves, which again is very limited, but letting them know is very important.
So a lot of companies that, particularly companies that operate outside of HIPAA, your company operates in certain situations within the HIPAA umbrella, are heavily criticized for selling or monetizing the personal data that they have. Acknowledging that there are different approaches to this issue, what's the position of your company on monetizing data?
Oh, I mean, if we ever did that, that would put all of our customers at risk and our business at risk because of that. So, I mean, absolutely not. We would never ever do that. We do understand that it is a concern, and we obviously sign BAAs with all of our customers and have all of our service providers sign those as well. Additionally, the only patient identifying information that we ever collect is the patient's phone number, so that we can send them real-time alerts. Now, theoretically, that could be traced back to a patient, but it's not like we have the patient's name, drug, other information. But in short, we would never do that because it would put our business at risk. But I do understand incentives for other businesses if there isn't so much of a risk that might be considered.
By all accounts, the guidance that has been put out by federal agencies, and specifically the Office for Civil Rights, which enforces HIPAA, and then the FTC under the FTC Act, the guidance, there's been some guidance, but it's very limited. Can you comment on what you think, how well you think the government is doing in terms of its job in educating the industry and helping them understand their legal obligations?
Yeah, so in our opinion, a lot of the guidance that's out there is guided toward a number of different. So apps are very, I don't want to say easy to create, but quick to create compared to hardware products. And because of that, there's lots of health apps that pop up each and every day. Oftentimes they're created by people that don't have a good idea of the industry or the necessary laws in which they need to abide by in order to operate successfully in that industry. So that guidance that we've seen out there publicly is sort of guided, is sort of meant for them, for people that don't really have an idea. Hey, HIPAA, it sort of educates them about HIPAA. HIPAA's a thing you have to follow, is sort of something that we've seen. So it's good for that first step, but every company has to take it upon themselves to comply. And every company is different, collects different PIIs, so no hard and fast rule. Basically, that guidance sends people in the right direction, hopefully, and it's up to the company themselves to take the right steps.
Right. So under the guidance that's currently been shared with industry, they say that if a health app is offered just directly to a consumer and there's no involvement with a HIPAA covered entity or what's called a business associate of a covered entity, which is just a vendor of a covered entity like a health plan or a healthcare provider, that you're outside of the regulation. But where a mobile app, health app is offered, they say on behalf of a HIPAA covered entity, that pulls you within the HIPAA rules. Of course, that's great to articulate the standard, but the trick is figuring out, looking at all the facts and circumstances and trying to figure out, okay, well, when are we acting on behalf of a covered entity or not? So there's a lot of confusion, I think, right now in terms of when the federal rules apply and when they don't. So that's another challenge. The agencies are certainly being criticized for that, and they're getting better. What they need to do, I think, is add more technicians on their staff. They don't have necessarily the technological experience to really craft the right guidance. But so let's move now. Thank you. Are there any questions for Reese? For Josh? Okay, great. So now let's move to Reese. So Reese, I think a lot of people will be completely amazed at what data science can predict about individuals based on their internet and social media activities. Digital health companies are consumers of and contributors to the analytics that are being performed. Given that the current legal frameworks are not designed to address the ethical dilemmas that arise in this context, what should companies do when faced with decisions about whether and how to deploy some of these analyses?
Sure, this is an interesting dilemma in that the internet is a global system, and companies who focus on the internet are thinking about the worldwide applications like Google or Facebook or Apple or whatnot. And regulatory frameworks are different in different countries, and so most of us carry phones, most of us are attached to the internet, most of us know our personal health circumstances better than our healthcare providers, and most often better than our own medical records. And our personal understanding of our health is in our phone and tracked by our phone and tracked on the internet and tracked by global companies that don't consider themselves subject to regulation in any particular country. There's sort of a term called the spotted cow strategy, which is the earth is a cow, and on the cow are different spots like China or India or Africa or the US that have different regulatory frameworks and different privacy rules. But the app, Facebook or iPhone or whatever, is the same on the internet everywhere. And few people appreciate the level of intimate data that is default collected from our phones 24 hours a day. Our phone knows where we are, how much we're moving, whether we go to fast food restaurants or whether we go to a farmer's market. And many of the apps that are installed, the default install is, for example, in Facebook Messenger, if you're going to use it at all, you give permission for them to turn on your microphone and your camera at any time, 24 hours a day, without your phone even being turned on. And so while you're sleeping, for example, it can be listening to you, or while you're having an argument. And these kind of things are it's a digital health issue in that your health, your emotions, your whereabouts are being converted into digital data that's being stored on the internet, and it's not even considered part of your medical information. It's your life, which is probably more important of digital health. And so there's things that have emerged that are predictive in health that are of great interest to people. For example, in the 3 or 4 months before people have heart attacks, their pattern of words that they choose to use in Twitter or Facebook or whatever is predictive of an impending heart attack. So people in the months leading up to a heart attack will use more swear words or change from their baseline use of language. And so the data analytics knows this. They know you're going to have a breakup in your relationship or divorce or heart attack or Parkinson's or things like this. It's sort of a dilemma, a moral dilemma for them. Do they let you know before that happens, or do they just let it happen? Or do they say, well, you should go see your medical professional to preempt this? And so this is like the practical reality of the internet in a meta global situation where some of that data eventually goes into a regulatory framework. And then, of course, with HIPAA in this country, you as a person can volunteer your private HIPAA information out, and you can tweet it or Facebook it, and that's your choice, your right to take your industrial strength private security information and say, well, I have this kind of tumor and I'm frustrated about it, and that should be your right and your choice, and you'll find other people in the world who have the same thing, and you can commensurate on what's the best path. So I think that's sort of a start on some of the dilemmas that expand beyond the regulatory framework of this country.
Right. So I think for a lot of people, what happens to their data on the internet is opaque. They know maybe that there are these companies called data brokers that amass data on them and that put them into categories like urban or rural and cash-strapped, or rural barely making it. But they also classify them by disease states. So individuals that have either purchased goods or shown an interest in products used to treat diabetes. Can you talk a little bit about how these data brokers might work, or how they might influence how healthcare is going to be developed?
It's a bit like surveillance and government observation of metadata on the internet for policing and security purposes, the metadata that is collected by the grocery store or your phone carrier or your social network maybe doesn't reveal precisely your name or what we would consider anonymized data, where maybe they erase your last name, but your first name and phone number and email and all that stuff is still there, and they call that anonymized data. And so but for example, your food eating habits can be tracked by your credit card company and your phone and where Uber takes you and what you choose to eat. That can be predictive of your likelihood of getting diabetes, for example. And this you can see as an invasion of privacy, or you could see it also as a benefit in that, well, if you're having a diabetic crisis and you've moved from your house into the hospital, Uber could deliver you your high glycemic food of choice to the hospital instead of your house because they know where you are. And so this kind of thing has downsides in that it feels violating of privacy, but it has upsides in that services can be delivered to you more appropriate for what you want, maybe not what you medically need, but what you want, and to where you are. And most people find that desirable. And so there's sort of a rule of thumb that isn't really attributed to a particular person, but it's people like Moore's law, as far as more transistors on a chip every year. There's sort of a privacy law where people apparently are becoming comfortable giving away twice as much of their personal information every year, year after year, and because they see a benefit for it personally, and it can be used against them, but it can be used to benefit them.
Right. And there's no doubt that life science companies are taking advantage of this data collection. There was a recent article in Bloomberg that talked about how several life science companies, not all, are doing what's called matchbacks. So they're taking data from data brokers in the healthcare sector, like IMS Health, who have data about your prescriptions that have been filled, and then taking data that's collected by internet advertisers, matching those in order to serve targeted ads to you while you're on the internet. And so this practice was discussed, this data practice was discussed in this Bloomberg article, and it was not painted in a nice way. It was very critical. And so one of the points that we'd like to make is that when you're thinking about data privacy and security, you really do need to think about the ick factor or the New York Times test. How is this going to look? While it may certainly and very effectively promote business, how is it going to look to the general public? And these questions about really ethics that the law does not address, I think are difficult for companies unless you happen to have an ethicist on staff. Or, Reese, maybe you can comment, what do companies do? Is it enough to sort of keep up with the trends and to understand, fully vet how the data will be processed and the product delivered, or what should they be doing?
Well, there's this saying, do the right thing. Google used to have in their corporate 10 rules of Google, don't be evil. And they stopped doing that last year. And they changed it to be do the right thing. And so you have to think of these sort of policies, not just how they apply in the US, but how they apply anywhere. So Google doesn't do business in China because the Chinese government's idea of doing the right thing is different than we might think doing the right thing is. There isn't like hiring an ethicist to be on an advisory thing. It seems like a step in the right direction, but you probably know in your heart what the right thing to do is.
And maybe all of you can speak to this, or definitely you, Reese. But the question about, I think a lot of companies, digital health companies, try to manage some of the data privacy and security risks with de-identifying the data or anonymizing it. But the tricky part there is that just like with digital health, and people have different definitions of digital health, they have different definitions of what de-identification is or anonymization is. So under HIPAA, there actually are defined standards. There's what's called the safe harbor methodology, and if you remove 18 identifiers from the data set, it can be considered de-identified. But the common criticism is that once you remove all those 18 identifiers, the data set's totally worthless. So the other option is what's called the Statistician Method, and there you can remove less than all 18 identifiers, so you can keep in things like dates of service, date of birth, things that are very revealing about people, but you're taking out the direct identifiers like name and address. However, there are lots of people who say that doesn't go far enough. So there are statisticians, very well-known statisticians like LaTanya Sweeney at Harvard, who likes to explain that approximately 86% of United States residents can be identified with just 3 data points: full date of birth, gender, and zip code. That's all they need. And so the statistician method is criticized as being not rigorous enough. Notwithstanding that, it is fully defensible to follow those standards, at least where you're talking about, where you're in the context of a HIPAA-covered arrangement. Where you're not, there are lots of companies that look to those standards anyway, because that's the best standards that we have out there. There are developing standards. NIST is getting into the game, and then also the European Medicines Agency has recently released guidance on anonymization. So we're seeing more and more standards here, but would it, can you comment on these criticisms of de-identification, whether you think the standards are good enough and whether you think we need more work there?
Well, it's sort of a cat and mouse or spy versus spy, a game that has been going on with encryption and hacking for a long time, in that once you use some kind of framework that's standardized to, for example, secure something, it then becomes a game of, well, how do you work around that? And so whatever standard is established, there will be ways to hack around it. Look at the FBI Apple phone thing, where they tried legally to say, well, give us a way to backdoor into the encryption, and the Apple said, no, thank you. And the FBI said, well, we'll hire some people to hack it anyway. They didn't decrypt the phone, they just put some hardware in the phone that bypassed the method that secures it from how many password attempts you make. And then they were able to get into the phone. So even though Apple has excellent encryption, the hackers working for the FBI in this case didn't have any trouble really getting into the data by just bypassing the front door was really well secured, and they just went to the back door. So these kind of things, the longer term trajectory is privacy is not practical to maintain even for governments or with military grade encryption. So for health records in a casual way, regulatory frameworks or algorithms or methods are unlikely to be long-term secure.
So don't be shy. Any questions about data privacy on the internet, what we're seeing in terms of the standards being developed for de-identification? Yes, great.
Actually, it's more of a comment. So you were talking about the matchback, right?
Yes.
That process, and to have targeted ads, but the same thing for non-drug or non-healthcare ads, right? Yeah, I can go to WashingtonPost.com, and before I know it, there's Nordstrom ads.
Exactly. I get ads for shoes a lot.
Right, yeah, exactly.
Why is that? I buy a lot of shoes, but
And
okay.
and for some reason that doesn't raise a Bloomberg article that
Right.
the pharma or healthcare related does. I
Yeah.
just think that's a really interesting commentary on
That's
American
so
society.
true. She said that we all know about how our internet activities our behavior, the sites that we visit, and the purchases that we make come back to haunt us in a way, or or help us. As Reese was saying, it's either positive or negative based on how you feel about it. But in healthcare, again, it really is. It is a different paradigm because people have these sensitivities, and I think that's why you get articles in Bloomberg or the New York Times about practices that are perfectly acceptable in other areas. Maybe it shouldn't be that way, but that's the reality, and so that's one of the bigger challenges.
So, following on with that, I think you said something very early in the presentation, Anna, about the utilization of the information, right, to make decisions on coverage, treatment, financing, etc. Perhaps far too simplistic, but couldn't a much easier line be drawn between utilization of the data and kind of collection and transmission of the data? Because it sounds like there are certainly benefits to collection of the data, there are utilizations in the context of drug discovery and finding the right populations to do an analytics against. But why isn't the government saying you can't use it for this 6 classifications of service?
Yeah, so that's a great question. And in fact, this is all being debated currently by the regulators. So Maureen Olhausen, an FTC commissioner, she's a big proponent for instituting or developing really a use-based framework for regulation. And I think that makes fantastic sense. And I think that's inevitably where we're headed. So currently, our frameworks of data privacy in the United States are based on FIPS, Fair Information Practice Principles. And those require notice, consent for processing of sensitive information, context-based restrictions, so not using the data for secondary uses. If you collected it for one purpose, you can only use it for that purpose. And these principles simply, with what's happening today with big data, Internet of Things, the growth of really the explosion of digital data, our historic framework just won't survive. But for whatever reason, regulators to date in DC and in many states, including California, have doggedly said and kept to the FIPS principles. But I think exactly what you raised, which is simply coming up with a framework that says, okay, you can use it if you want even if you collected it for one purpose and it had nothing to do with research, but you can use it for research if there are protections around that because it benefits the public. Unfortunately, we're not seeing that yet. So let's move now quickly to a really important topic, which is cybersecurity. Obviously, that's a big concern with digital health. Internet connectivity in healthcare triggers many data security issues. Maybe, Michael, if you could speak to some of the greatest cyber threats, and besides China, and how do you think about managing these threats in product design?
Okay, well, I guess I want to comment first of all, full disclosure, I'm not on Facebook for precisely what he suggested. So I think that one of the things that I think, we have to, one of the assertions I guess I'm going to make, is we have to have a different mindset, I think, relative to security. And that is, up to this point in time, and I have even say my colleagues have the same viewpoint, that is, we do use-based security. In fact, I'm even I'll challenge you a little bit on your use case.
Good.
It's a narrow there for privacy. But what happens is with the use case, you have to figure out where the misuse case is, right? So, and the reason we've done that is because previously performance was a big deal. So if you talk about encryption, disk encryption, or you talk about, some other methods of protection, what would happen is the speed of the computer, the infrastructure wouldn't support, there's all kinds of barriers of entry, but what happens is still an old school thought of, well, we just encrypt what we think is important. And so, I'm claiming what we need to do is turn that upside down. You really need to encrypt everything and then back off the encryption, right? In other words, okay, I can't afford the performance, so I gotta unencrypted, right? I'll let this stay in open, right? Or it's too tough to mitigate if my secret gets out, okay? And if you do it that way, then you don't have to cover all the spaces that you haven't thought of, right? Okay, you deliberately choose to open things up, and I think that particular method would work. Quite frankly, I think it'd work in this instance as well, because what happens is if you try to do the other way, all the exploits you see, not claim even the ransomware, right? Much of that is because there were things that they could have encrypted, but chose not to because they didn't think it was a threat. They didn't think it was. They said they did their threat analysis. Oh, nobody will ever do that. Well, okay.
That being accessing the administrative data,
exactly,
billing
accessing
data.
billing data, or accessing or coming through the air conditioner as they did in Target or whatever. No one's ever done that. So they don't. And so I think the one thing we have to do is we have to approach it really where you encrypt everything and then you back off the encryption. And I think I think the same thing with privacy. I would claim privacy-wise, there are methods. Now I think in our earlier conversation, one of the things is there are no real standards for that. And I guess I kind of respectfully disagree with the notion that because someone break it, you don't do it. Because if we recall 20 years ago or 10 years ago, right, people broke encryption's SSL. Everybody keeps calling it SSL. It's not SSL anymore, it's still S, right? I mean, as far as transport layer security, right? So that's really the standard, even though people still call it. But SSL was broken back in the late 90s. And so I think that we got to recognize that those things are going to happen, but you still do it, right? And I think that in this instance with the privacy, I think you can do, quite frankly, the same thing. But we haven't convened a group that says, okay, here's how we're going to do this. Here's how we're going to approach privacy, and we're going to have the various levels of privacy, and we're going to do it. And then you can always then audit people, because I concern myself when you say, optionally companies can choose to kind of, self-police. Well, the challenge with that, just quite the same reason why we've come out with standards on, quite frankly, it was in place, right? Because we couldn't self-police. I mean, people say, oh, I'll do it this way, I'll do it that way, I'll anonymize this way, I'll undo it. So yeah, I think you're going to have some standards here. This may be, quite frankly, the healthcare industry may be quite, honestly, the group that really drives that standard, right? I mean, because your security team says we would like to drive it, right? But in reality, we have to have healthcare, the principal party who really, has to care about it, really be in part of the driver's seat, because there's ways that you implement it and the ways that are going to be inconvenient to do it and things like that, but I think it will be aligned with the security, quite frankly, how you do it. So.
In terms of just where things stand with the industry, healthcare industry overall, where do you think they stand in relation to their sophistication, their approach to data security as compared to other industries like the financial industry?
Well, I think healthcare gets a lot of lumps. But I mean, I work with some of the brightest people in the world in designing these devices, and they're not dumb. But what they do is they place the patient's safety and health on top of everything. So that's as simple as that, right? He said, I always like to give my colleagues that do defense versus healthcare, right? The healthcare people care about what happens to you, right? The defense people don't care about that. They care if it's secure, right? So you have two extremes, right, of thought. And so I think that's what you have. So I think healthcare just has to recognize that now this data is going to be valuable, right? I mean, again, poor Medtronics guys, I'm in meetings with these various meetings with them over time, and it's interesting, they always, you always say, they always put their head down and say, yeah, I know, we were hacked, right? I mean, because everybody kind of points to the in this case, insulin, right? The insulin pump was hacked. And they said, yeah, we didn't have security on that. But in reality, they did what I mentioned earlier, they did use case, they did, intended use case security. So no one is going to hack that. They're not going to come out differently. So I think it's really important that we recognize that the real exposure there is that, from a healthcare perspective, that we really start, just as I suggested earlier, we really secure everything and then back off. And I say manufacturers are doing it, and by the way, one of the challenges healthcare has today as well is much of the equipment stays around for years, right? So, there are still shipments of equipment, new equipment that are shipping XP. So just so everybody, so you'll always hear exploits, and people are trying to protect those pieces of equipment. So that's also why healthcare takes its lumps, because there's a lot of equipment that lasts 10 or 15 years that perfectly good equipment, it's got an exploit, but they can't throw away a $5,000, $10,000 piece of equipment just because the manufacturer EOLs it, and they have to now replace that. They can't afford that.
Yeah, we see that. So in due diligence transactions where our clients are looking at buying other healthcare companies that have deployed certain technologies, one of the really critical things to ask is, okay, where are they in terms of their data security? Have they kept up? If they haven't kept up, which is almost certain, how far behind are they? Are we talking a decade? Are we talking a decade and a half? That can impact the investment. As we saw with Hospira, let's talk about that just a moment. I find that case to be so interesting because the data vulnerabilities, the fact that that device could be hacked and then manipulated at the bedside of a patient, that of the infusion pump, that was brought out by a white hat hacker, Billy Rios, and now, and because of that, in part, FDA took an action and sent a warning letter to hospitals saying don't use this device, which had a little bit of an impact on the value of that product. So how do you feel? How do you feel about white hat hackers? Do you embrace them? Should manufacturers embrace them or not?
Oh, I think they should. I mean, some of the manufacturers, one of the big three is really embracing them, as you might imagine, to actually go and do analysis on the devices. And by the way, I think what was mentioned earlier about security. When we're evaluating security, we're always evaluating one, risk, and two, how much does it cost to mitigate, whatever it is. Now, clearly, when they did their threat analysis, right, they did not expect, right, that you'd have physical possession of the device. Because when you look at security, you look at that, right? You say, can you break, for example, in the Apple case, Apple could have always have broken into that. They didn't have to go against that. The FBI would have always have broken into that device, I promise you, okay? I don't know why they decided to go after Apple for this. I think they're trying to make a point, but they could have always done that. If you have physical possession of the device, it's highly likely with enough money you can break in, right? And naturally, as we're with CPUs and things like that, we know that too, right? So in this particular instance, when he broke in the white hat that did that, in fact, I just saw him a couple days ago, so I know him. I think, I challenge him a little bit because if you've got that model now, and you say, okay, I'm gonna have a patient that can break this device, right? Now you gotta, now you're gonna add more money to that, and this is my last point is gonna really be, one of the things HDOs and others have to recognize that security is not free. So if you're gonna do it, be ready to pay for it, because manufacturers are not gonna do it just out of the kindness of God. They're gonna charge you for it. So that's also kind of the takeaway.
So any last minute, we only have a few minutes, but we'd love to take additional questions if anything we've said has raised some questions in your mind. Yes?
Yeah, so I'm kind of going to merge two points that were made. The last point that was made about it costing a lot of money, and then going to Josh's discussion about how from the very beginning of his company, it was thought we're going to do this in a compliant way, we're going to spend the money. I mean, Josh, if you could talk a little bit, what drove that? I mean, a lot of companies don't think that way. We'll get the product out there and then we'll sell it back in. So what was unique about your company? Not unique, but what was in the DNA of your company that you decided to invest up front?
Yeah, I'd say it was probably guided by two things: the recommendations of the consultants and lawyers with whom we've worked, and then also we did our diligence to find out what our customers would need, and then also what would look good in their eyes. So that really guided our whole framework. But it was not cheap to do. We had to raise money to do it. So yeah, it was not easy or something small in nature.
If I may comment, the major manufacturers, right, are embracing that notion now, right? I mean, many of them do the threat analysis. They now have to concern themselves about physical possession of the device. Now that the Rios did the work he did, which is good. But I think so I think now you see from now on you'll start to see more and more of the security rolled in. But still, as I've warned most HDOs, right, a lot of the customers won't implement it because, I'll say I was with an infusion pump company many years ago back, and we're talking about security measures. And they're buying it. They're saying, oh yeah, we're gonna put that on the next one. But I tell you what, my big challenge is mine has $200. I gotta have other guys add the $200 too. Because what's gonna happen is when I'm sitting in a bid and I'm all of a sudden there are 1,000 infusion pumps flying out, I'm $200,000 more than their bid, and I've got security, great security, but the HDO bean counter in this case doesn't value it. then I'm the one that loses the business, right? So that's their hesitation on just going wholesale, moving go down. As a startup, interesting enough, that's a differentiator, right? So fully expect these guys to be completely secure because that's going to differentiate them from any of their competitors, right? As long as they have that, then, and everyone sleeps well at night, they know they've got that kind of security.
Yeah, we actually push that point. We ask our customers to evaluate us on our security, so it's exactly true.
And did you find your investors bought into that strategy?
They honestly, they sort of trusted us to navigate the path, but I mean, they cared more about traditional investor items.
Very good. Okay, thank you.
Thank you.
Thank you very much.